The World Health Organization has this statistic that says that between 20 and 40% of resources for health globally are wasted. They followed up on this statistic by identifying the 10 leading causes of inefficiency.
You really have to work with the people who are there in the country because they do know already. However, it is very useful also to know what is available out there in the other countries, in literature about what are the top 10 causes of inefficiency.
Human resources for health, doctors, nurses, auxiliary staff, administrative staff, take up about 50% of the total health budget, and drugs and medical supplies take up between typically 20 and 30%. So it's not a surprise that the technical efficiencies or inefficiencies and potential for savings are in these two sectors.
Perhaps more importantly, what are the top 10 causes of potential efficiency gains, which now turns the conversation from just identifying the problem, but actually looking at the solutions.
There's two possible ways, I think, to think about that. The one is the sort of macro vision in which you want to ensure that there is a very good articulation between your different health financing functions. Very often this is long-term and quite deep, complicated reform. Another way to look at that is to look in the detail where are the inefficiencies in a given context.
So the Efficiency Savings in Uganda project is a project we've been working on with UNAIDS and the Uganda AIDS Commission to try and find ways of making better use of the funding that is in the HIV/AIDS sector. Some of the successes include developing this approach to actually measure efficiency savings within the health sector.
This is the starting point. The measurement is the starting point.
The challenges we've encountered include finding or getting adequate data to measure sources of inefficiency in the country.
It's actually not just saying it is cost saving. It could actually be the denominator, which is improving the outcome in terms of not only quantity, but qualities.
And we think and we feel that it is a very good approach that can be refined further to be useful across many countries.
Well, there is a very strong relationship between technical efficiency and universal health coverage. We need a lot of resources for health to achieve universal health coverage, and we need to use these resources well. Without having efficient health systems, we will not achieve universal health coverage. So in that way, technical efficiency really a priority, I think, for many countries.